7 major Social Security changes have happened this year. And I am going to talk about how those changes, each of them, affect your benefits. I'm going to go into details about that. And then that is going to set the stage for what's to come next. There are 7 big proposals in Congress right now to change Social Security and, most importantly, increase benefits. There are 2 proposals that is in front of President Trump that they are pushing to increase Social Security benefits for all beneficiaries, including disability beneficiaries. I am going to talk about those changes in details and walk you through what they mean for your benefits. So let's get into the details. I am Kwame Kwade. I am a personal finance expert and an entrepreneur. For 15 years, I've been helping seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we're adding video. I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. I really appreciate your help. And do me a favor. I'd like to know where you are watching this from. I see somebody from Ellicott City, Maryland. Just go into the comment section and let me know your city and your state. So let's dive into the 7 big changes to Social Security that have happened this year that affects everyone. And I'm not just going to talk about the changes. I'm going to talk about how they impact your benefit and what you need to look forward to. So the first thing is COLA. Why am I talking about COLA? Is because the COLA increase was so small this year that it has put a lot of seniors behind. If you are on Social Security retirement benefits, your COLA increase was a tiny $50. And if you're on Social Security as a couple, your increase was $75. Now I have somebody from Michigan. I have Nancy from North Carolina, Jane from Sherman Oaks, California, and Joyce from Painesville, Kentucky. Like, keep them rolling. I want to know your city and your state. If you're on SSDI, your increase was $38. If you're on SSI, Supplemental Security Income, you got a tiny $24 increase. And if you're a couple on SSI, it's even worse. You got $35. So what does this mean and why should you care? Well, it's because Social Security cost of living adjustment has not kept up with inflation. Over the last couple of years, inflation has gone up about 30%, and Social Security benefits have gone up about a tiny 20%. And so seniors are always falling behind because what you can buy with your Social Security benefits increases get eaten up by things like Medicare premium that have also gone up by 6%. We have people from Folsom, California. We have Brenda from Belson, Texas. And then we have Paul from Panorama City, California. So let's talk about the next big change that has happened. The maximum benefit at full retirement age is going up. Why is that important? Full retirement age is when you get the maximum Social Security benefits you deserve. For some people, it is 66 years and 10 months. If you were born after 1960, it is 67 years permanently. That changed in the Reagan administration when they moved the retirement age to 67 years from 65. And so if you have paid into the Social Security system the maximum benefit and you're expecting that and you're retiring this year, the maximum money you can get is $4,018 per month or $48,216. That is on the high side, but it's an increase from the previous year of $3,882. Now, why should you care about this? Well, it's because if you are trying to think about what is the maximum benefit you can get in Social Security, this is it, $4,018 at your full retirement age, unless you wait until age 70. And then we have Christy from Reidsville, North Carolina. Yeah, keep them coming. I want to know where you guys are watching this particular broadcast from. Let's talk about the next thing, Social Security tax limit. Here's the thing that a lot of people don't know. Your Social Security benefits obviously are taxed if you reach a certain age, but Social Security is funded by payroll taxes, and each year they increase the threshold. But did you know that only $176,100 in Social Security tax benefits are taxed based on income? So if you make more than $176,100 in 2025, you do not have to pay Social Security taxes on anything above that. If you make 200,000, you don't have to pay anything above 176,100. If you make $2 million this year, you only have to pay Social Security taxes on 176,100. Now, I'm telling you all this. Why? Because it impacts the situation that Social Security is in right now. I'll explain that in a second. We have one new person, Miss Beverly Fields from Atlanta, Georgia. Thank you for watching. So, what am I saying? Well, the government keeps saying that Social Security is going to run out of money in 2033. Well, there's a problem there. It is because more people are being paid Social Security benefits that they've earned versus people that are paying into the Social Security system. There are less people working now paying into Social Security than people that are claiming Social Security benefits. And so that is how the system is run, is that on an ideal situation, the number of people paying into the system is equal to the number of people that are paying taken out of the system. Well, that has got out of whack. And so now you have a deficit. Every year, there's $200 billion deficit. And that is currently being taken out of the Social Security Trust Fund, which is where they store all the surpluses that were happening over the last couple of decades. And now they are withdrawing those surpluses to fund the deficit that's happening. Well, in 2033, that money is going to run out. And in 2033, if nothing is done, they're going to cut your Social Security benefits by 21% automatically. So here is why this earnings limit is important. If the government wants to save Social Security, the easiest way they can do that is to just eliminate the earnings cap. Why are they limiting Social Security taxes to only $176,100? So I'm going to talk about some proposals at the end. So stay till the end of this video because I'm going to talk about some proposals that are in front of Congress to fix Social Security. One of them is what you're looking at right now. This is part of the problem, is that not enough money is coming into the Social Security system because we've capped how much you can tax people's paycheck or income to 176,100. So somebody making $1 billion is only going to pay Social Security taxes on $176,100 of their income. Somebody making $1 million, same thing applies. Meanwhile, if you're making 50,000, all your income is subject to Social Security. If you're making 90,000, all your income is subject to Social Security. But somebody making 500,000 only gets $176,100 of their income subject to Social Security taxes. That is why we're in the problem we're in. And hear this. If they eliminated the cap, they can fund a Social Security increase for everybody, including disability beneficiaries and Social Security beneficiaries. They can give you extra $200 a month and still save Social Security system for another 75 years. That is why this change is important. If you're on disability benefits, this is your change that has happened and you need to pay attention. There's something called the substantial gainful activity limit. What it means is that if you're on disability benefits, this is how the Social Security Administration determines whether you are still disabled if you are working. If you work above this limit, and for the non-blind, it's $1,620. If you earn more than $1,620 and you're getting disability benefits, you are at risk of losing your benefits because then you have crossed the threshold of what they call the substantial gainful activity limit. And now your benefits are going to be reevaluated, sometimes even taken away completely or severely limited because you have crossed that limit. So that is a number that increases each year with the COLA increase. And it's important to pay attention to that. Let's talk about Medicare. There's been a lot of changes that have happened in Medicare this year, and I want to bring a few of them to you. The first one is that Part D out-of-pocket costs will be capped at $2,000. Why is that important? Why should you care? Well, it's because if you are on certain expensive medication and previously you had to dig out of pocket a lot, this year, once you reach the $2,000 limit, then Medicare takes over and have to pay. So if your medication costs $20,000, you only have to pay $2,000 and Medicare pays the rest. Previously, there was a complicated system of caps and deductibles and this and that you have to navigate when it came to prescription drugs under Medicare. Now that has been fixed. There's a $2,000 cap. There is also Medicare premium increases for Medicare Part B, which is taken out of your Social Security check if you are receiving Social Security benefits, that has gone up to about $185 a month for some people. And another change I want to bring into your attention is that Medicare Advantage enrollment is expected to continue to rise. More and more people are signing up for Medicare Advantage plans. And I have big news I'm going to share with you at the end about a specific help that you can get to be able to save $1,100 on your Medicare bill. Another change that happened this year is the early claimers can, need to watch out if you are working. So if you are currently receiving Social Security and you started receiving it early, maybe at age 60, 62, 63, 64, before your full retirement age, and you are still working, you may know that there's an earnings limit. Why is that important and why should you care? Well, I'm going to explain it to you. The earnings limit is there if you make more money than the threshold, they have to deduct money from your Social Security check, but you have to report that income. Well, what has been happening is that a lot of people are working, they're on Social Security, they haven't reached their full retirement age, and they are not reporting their income to Social Security. That may go on for years. And then one day you're going to get a bill from the Social Security Administration, maybe like $20,000, $40,000, $50,000. I've seen some people get hit with a $100,000 bill from the Social Security Administration saying that they paid you more money than you were eligible for because you were working while on Social Security before your full retirement age and didn't report your income, or you went above the threshold and you didn't report that. And so you get hit with overpayment. Well, the Trump administration now we're changing the rules so that if you get overpayment from Social Security, they're going to take your entire Social Security or disability check, use that money to pay for all your overpayment until it's paid off, and then they'll give you your money. They start resuming your Social Security check. That was going to devastate a lot of people. They changed their mind after a lot of pressure. I did a video about it and asked a lot of you to call your Congress people and call your senator and call your congressman and woman. And a lot of you did. And the Trump administration changed their mind after a lot of pushback. And now they're only going to claim 50% of your Social Security check if you fall into an overpayment situation. That's still a lot of money. It's half of your Social Security check. So if you want to avoid that situation, if you are working and you're on Social Security before your full retirement age, you can only make $23,400 and avoid any money being taken out of your Social Security check. If you go above this limit, for every $2 you go above it, you lose $1 of your Social Security. So if you make $12,000 more than this limit, you're going to lose $6,000 of your Social Security benefits for the year. That is a good way to view that. The next change here is that if you reach your full retirement age, the year of your full retirement age, if 2025 is the year you're reaching your full retirement age, you can work and earn up to $62,160 and not get anything deducted from your Social Security benefits. For every $3 you go above that, you're going to lose $1. So it's more generous when you reach your full retirement age, but you have to pay attention to the earnings limit. And once you reach your full retirement age, you can work as much as you want and not get anything withheld from your Social Security benefits. However, you'll be subject to Social Security taxes. And for some people, up to 85% of your Social Security benefits combined income could be subject to Social Security taxes. The next big change is that the full retirement age keeps creeping up. Why should you care? Well, the full retirement age is when you get your full benefits or you're eligible to get everything that you've worked for. And in this year, 2025, the full retirement age is 66 and 10 months. So if you were born in 1959, that is your full retirement age if you're retiring this year. Next year, the full retirement age sets permanently to 67. And as I said before, that is a change that happened from the Reagan administration, where they changed the full retirement age from 65 to 67. Now there's a push to push it further to 69 or even 70 years old. I am going to talk about that shortly, about the 7 changes that the president is looking at. So if you have any comments about what I just shared, let me know in the comment section below. What do you think about the COLA increase that happened? Are you happy with it? Do you think COLA should be more? And if it is, how much do you think they should increase Social Security benefits by every single month? Let me know in the comments. Now, A lot of people have online on YouTube, especially talking about Social Security increase. That never happens. And so there's a lot of clickbait happening about Social Security increase. I'm about to get real with you. There are 7 proposals in Congress right now to fix Social Security. 2 of them are to increase Social Security benefits for seniors. And so I'm going to walk you through each of the 7 proposals, and I'm going to walk you through the 2 proposals that are to help increase Social Security benefits. And then you decide what you think the president should push and should support in helping seniors this year in 2025. So the first thing in front of Congress, the first proposal is the Social Security Expansion Act. This has been around for a little bit, but now has started gaining a lot of steam. The Social Security Expansion Act, introduced by Senators Sanders, Warren, and others, would boost Social Security benefits by $2,400 a year. That is an extra $200 each month for every beneficiaries. This would provide immediate and significant relief to seniors struggling with rising costs. The proposal is projected to lift millions out of poverty, addressing the fact that over 26% of seniors currently survive on less than $17,500 a year. The plan funds the benefit by boosting the Social Security payroll tax. Remember when I was talking about increasing the Social Security payroll tax? Well, this is what it would help also do, is help fund a $200 increase a month for seniors and disability beneficiaries in 2025 if this is passed. According to the Social Security Administration estimates, this proposal, if all they did was remove the Social Security cap or increase it to $250,000, not only would it put $200 a month in your pocket as a Social Security beneficiary, and it would also extend the lifespan of the Social Security Trust Fund by 75 years. So this is why I put this as the first proposals, because this is the thing that has gotten a lot of momentum in Congress, and President Trump is being urged to get behind it. Proposal number 2 is a new minimum Social Security floor for beneficiaries. This is really, really important, and it will put $500 a month in some people's pockets. Let me explain. Right now, there are a lot of seniors that are living below poverty because they're getting very little Social Security check. This proposal is to set a floor that no senior that has worked and paid into Social Security and is eligible should make less than 125% of the federal poverty level. That translates this year to $1,500 a month, $1,518. Why should you care about that? Well, if your check is lower than that, the average Social Security beneficiaries is going to get a $500 a month increase if this legislation is passed. This is a big, big deal. A lot of people have fought for this, and now it's getting a lot of buzz in Congress to increase Social Security and put a floor that nobody gets less than $1,518 a month as of 2025, and it will grow by COLA every year, so you get increases every year. That is proposal number 2. Proposal number 3, as I mentioned, remember I was telling you that Social Security is funded through payroll taxes, and now there are less people working compared to people that are taking money out of the system. One way to increase or save Social Security is to bring in more money or slow down how much money is getting out of the system. One of the ways to slow down how much Social Security fund money is going out is to increase the retirement age again. If you increase the retirement age from 67 to 69, you will solve 30% of the problems that have hit Social Security. So when politicians are saying Social Security is going to run out of money, if you increase the retirement age from 67 to 69, you are going to solve 30% of that problem. Now, critics point out that many people in physical labor jobs cannot work into their late 60s, making this change particularly burdensome for certain workers. The proposal would disproportionately affect low-income workers who often have shorter life expectancies and more physically demanding jobs. Now, another proposal to slow down how much money is getting out of the Social Security Trust Fund is to reduce how much COLA you are getting. I know this is going to upset a lot of seniors because cost of living adjustment for 2024, which was implemented in 2025, was 2.5%. And now they want to even cut it back further. Why? Because even though Social Security increases are not a lot of money, they still come out of the Social Security Trust Fund. So if you want to extend the life of the Social Security Trust Fund, one way to do it is to slow down how much cost of living adjustment you are giving seniors and people on disability. And that is what this proposal is about. And that is one of the proposals in front of Congress to limit how much Social Security cost of living adjustment you get every year. And if you were here in the beginning of the video and you saw the chart that I showed that explained the increases, this particular proposal can feel a little cruel because seniors only got $49 increases this year, and now they want to even slow that down even further. Proposal number 5 is to increase the payroll tax. That's how you bring in more money into the Social Security system, is by raising the payroll tax from 6.2% to 6.5%, and they're trying to do it over 6 years. Why is this important? Well, the 96% of how Social Security is funded is through payroll taxes. Employees pay 6.2%, employers pay 6.2% for a combined 12.4%. The idea is to increase it from 6.2 to 6.5 over 6 years, which will eventually raise it from 12.4 to 13%. Why is this important? Well, it means that more money will be coming into the Social Security Trust Fund and will solve some of the problem that the trust fund had and extend its lifespan. This is a very popular proposal. 85% of Republicans supported, 88% of Democrats. It is a politically viable solution, and it's one of the proposals that is actually likely to pass this year because it's so popular among both parties. The next proposal is an income cap removal. I talked about this earlier, and I want to explain it in detail. So currently, you have an income cap of $176,100, where if you make up to that point, you have to pay Social Security taxes. Now there's proposal to put a new cap at $250,000 or even $400,000. So if you make more than $250,000, you pay Social Security taxes. Also, in addition to your first $176,000, you are going to pay taxes on $250,000 and above. And then it's going to put something in the middle called a donut hole, which hopefully closes over time because of inflation. So the new legislation would do that. It will affect 4% of the population, but extend the lifespan of the Social Security Trust Fund by a whopping 75 years. Guys, this is big. And they're going to close loopholes so that some rich people do not scheme the system and avoid Social Security taxes. They're going to apply this on all income above $200,000. And if you want a good example of why this is important and how this will bring more money into the Social Security system, let me share an example with you. If, for example, you are making $500,000 last year, you would have only paid $10,000 in Social Security taxes. Somebody making $50,000, because all their $50,000 is subject to Social Security taxes, they'll pay $3,100. That is 6.2%. But the person making $500,000 will only be subject to Social Security taxes on their first $168,600. That was last year's limit. If a new cap is put in place where not only do you pay Social Security taxes on the first limit, but you also pay anything you're making above $400,000, then somebody making $500,000 last year would have paid $31,000 in Social Security taxes. That's 6%. So you can see the difference. It's like night and day. And the problem is that currently you are only taxed on the first threshold. If you make $10 billion, you still get taxed on your Social Security, or you only contribute towards Social Security from your first $176,100. And that is why this proposal is so important. And then the final proposal in front of Congress is to means test Social Security. So means testing, it means that you get benefits according to how much money you have versus how much money you've paid into the system. So Social Security means testing will evaluate income levels to determine benefit eligibility, potentially reducing benefits for higher income retirees. This approach could reduce the program's shortfall by 11%, but is very popular, and it shouldn't be surprising. 90% of Republicans and 94% of Democrats support this idea of preserving Social Security for the 80% of people in low income and middle income, and then people who are in higher income get less benefit regardless of how much they paid into the system. Now, I am just a messenger. I'm telling you, this is the proposal that is in front of Congress. I want to hear from you what you think about all these 7 proposals to reform Social Security. I think the first 2 that is proposed to increase income should be something that should be passed. And removing the cap on Social Security, I think, is a good idea. So finally, let's talk about Medicare. If you're turning 65 and you're wondering what you're going to do about Medicare, stay tuned. If you're on Medicare and you're not happy with your benefits because there's so many changes that are happening with Medicare in individual states, some states are dropping benefits. In Minnesota, people are choosing between whether to stay in their doctor network or health plan. I have some big help for you. Here's the thing: 24,000 Medicare plans out there. Each senior is supposed to figure out what is right for them, their budget, their coverage, and the Trump administration just sued 3 major Medicare advisory companies for misleading seniors and steering them into plans that were not good for them. Well, we are here to solve that and help you with our partner, Chapter Medicare. Chapter is so different from all the Medicare advisory companies out there. That is why we're working with them, and I'm going to explain to you why. The first reason is their whole philosophy. They are there to make Medicare simple, to help you understand it and choose the right plan for you. And one of the co-founders actually had a personal experience. He watched his parents struggle to navigate the Medicare process, and they wound up paying premiums that were hundreds of dollars a month, more than they ought to have been. He realized what a terrible experience this was and wanted to do something about it. Another co-founder actually wrote a leading book about it, and here's what he has to say. He said, "When I started my job as a Medicare advisor, I discovered that many Americans were getting misled into buying the wrong plans simply because no one took the time to sit them down and explain what was going on." So that is their whole philosophy. They want to help you understand Medicare. They have access to all 24,000 plans, and they are the only company that does. And they don't pay their agents, their licensed agents, to sell you specific plan. They are there to advocate for you. So Chapter is the real deal. That I've been doing this for 15 years. I've never partnered with a Medicare advisory company until now because these guys are legit. Check them out and call them today. You have a very small window to change into a better plan. Or if you're turning 65, you have a very even smaller window to elect a plan. So call them at 539-205-2147 or go to their website, askchapter.org/insider. These guys are legit. These are real people you're going to be talking to when you call them. This is directly from their website. They're licensed agents who are not being paid to push you into a plan. They are being paid to advocate for you and not the insurance company. And they will show you every option available to you, including detailed information about doctors, specialists, prescription drug, hospitals, co-pays, and then help you compare each plan to traditional Medicare and make a good decision. I mean this because we are committed to our brand's integrity, and we would not partner with a company if we didn't think they were there to advocate for seniors. So call them today. They're there to help you. A+ rating with the Better Business Bureau, lots of 5-star reviews, and they can save you a whopping $1,100 a year. So that's pretty much what I have for you today. If you haven't signed up for our newsletter, please do so. If you want to get money saving tips, discounts, and stay on top of everything that is happening in and out of Congress that is going to affect your Social Security, Medicare, Medicaid, go to the top of our YouTube channel. There's a link there. Put in your email address, and we'll be sending you information that you wouldn't get anywhere but with us, because we do the research. As you can see, we're very thorough in our presentations. We do the research, and we bring you the latest information so that you can stop missing out on your retirement benefits. So that is all I have for you tonight. I am glad you spent this Thursday night with me, and looking forward to seeing you tomorrow, same time.